Welcome to UMCC Medical Consultants, where your health matters to us. Ever wondered how caffeine, a common methylxanthine, affects your body? Well, buckle up because we're about to explore the fascinating world of methylxanthines. These naturally occurring compounds, found in everyday items like coffee, tea, and chocolate, pack quite a punch. The most common examples include caffeine, theophylline, and theobromine. What are some of the uses of these compounds? You might be surprised. They're often used as drugs for respiratory diseases, giving relief to those with conditions like asthma or chronic obstructive pulmonary disease. Additionally, they're used to treat apnea in premature infants, providing a vital lifeline for our tiniest patients. And of course, the role of caffeine as a CNS stimulant is well known, helping millions wake up and power through their day. Now that you have a basic understanding of what methylxanthines are, let's delve deeper into how they work. Stay tuned to explore the action, absorption, and metabolism of these intriguing substances. How do these methylxanthines actually work inside our bodies? Well, let's take a closer look. Methylxanthines, which include substances like caffeine and theophylline, have a few key roles in our bodies. They primarily act as phosphodiesterase inhibitors. Now, without getting too technical, this basically means they block the action of an enzyme called phosphodiesterase. By doing so, they increase the levels of a substance called cyclic AMP in cells, leading to effects like bronchodilation, which is why they're often used in the treatment of respiratory diseases like asthma. In addition to being phosphodiesterase inhibitors, methylxanthines also act as adenosine receptor antagonists. Adenosine is a substance in the body that can cause feelings of sleepiness, among other things. When methylxanthines block these receptors, they prevent adenosine from doing its job, which is why your morning cup of coffee can help wake you up. Now let's talk about how these substances get absorbed and metabolized. After you consume a methylxanthine, it's mainly absorbed through the gastrointestinal tract. From there, it's distributed throughout the body, including the brain, which is why it can have such a wide range of effects. Most of the metabolism of methylxanthines happens in the liver, where they're broken down into metabolites and then excreted in the urine. So methylxanthines work by blocking certain enzymes and receptors, but what happens when they interact with other drugs? Well, stay tuned to find out. What happens when methylxanthines meet other drugs in our body? Well, it's like a cocktail party where everyone's personality can influence the others. When methylxanthines mingle with cimetidine, a drug used to treat ulcers, the body's ability to break down and eliminate methylxanthines is reduced, leading to increased levels in the bloodstream. Erythromycin, an antibiotic, also likes to slow dance with methylxanthines. This duo can cause a spike in methylxanthine levels, leading to an increased risk of side effects. And then there are contraceptives. Long-term use of these can increase the half-life of methylxanthines, meaning they stick around in the body for longer. Now, what happens when methylxanthines have had a little too much fun at this party? The side effects can range from mild nuisances like nausea, insomnia, and restlessness to more serious issues like heart palpitations. But the party doesn't stop there. In some rare cases, methylxanthines can cause adverse reactions like arrhythmias, a condition where the heart beats irregularly, too slow or too fast. There's also the risk of seizures, a sudden surge of electrical activity in the brain. Remember, these are not inevitable outcomes, but potential risks. The likelihood of experiencing these side effects or adverse reactions varies from person to person, depending on factors such as dosage, individual tolerance, and overall health. Thus, while beneficial, methylxanthines must be used carefully due to potential interactions and side effects. But what about their use in special conditions like pregnancy? Are methylxanthines safe to use during pregnancy? It's a question that has been asked and studied extensively. The consensus is that, in general, methylxanthines are considered safe for use during pregnancy. However, like all medications, they must be used with caution. High doses of methylxanthines can potentially lead to fetal growth restriction. This is because these substances can cross the placental barrier, reaching the fetus and impacting its development. Therefore, it's essential for healthcare providers to carefully monitor the dosage and frequency of methylxanthine use in pregnant women. Now, let's talk about further interactions. Methylxanthines can interact with certain diseases, such as liver disease and heart failure. These conditions can alter the way the body metabolizes these substances, potentially leading to an increase in side effects or a decrease in effectiveness. Therefore, while powerful, The use of methylxanthines must always be tailored to the individual's unique circumstances. So, let's quickly recap what we've learned about methylxanthines. These compounds, including the familiar caffeine, have diverse uses from stimulating the central nervous system to relaxing the smooth muscles. They're absorbed in the gastrointestinal tract and metabolized in the liver. Interaction with other drugs can be complex, causing a range of side effects and adverse reactions. In pregnancy, usage requires caution due to potential risks. Remember, while methylxanthines like caffeine are part of our daily life, they are still drugs with potential risks and benefits. Always use them wisely. UMCC, your ultimate medical consultant connectors.